So this, again, is an accurate description or schematic of the brachial plexus. The only difference is that this is superficial to the clavicle. This all should be going directly deep to the clavicle, passing through this space, through the subacromial space, to go into the brachium, ultimately towards the hand. When you're looking at the first part that comes off of the vertebral column, you have the roots of the rami, starting with C5, C6, C7, C8, and then T1. Looking at the blue here, you have the three separate trunks named appropriately. So you have the upper or the superior. The trunk that's in the middle is named the middle trunk, and the most inferior is the inferior or the lower trunk. From there, each of the individual trunks are going to give off both an anterior and posterior division. If you look, you can see the yellow posterior divisions coming off from each of the trunks. Those will feed into the posterior cord, which relative to the other two orange cords, the medial and the lateral ones, the posterior cord will be more posterior in the brachium. Jumping to the other three anterior divisions, you have the superior trunk giving off an anterior division, with the middle trunk giving off an anterior division, which will feed into the lateral cord. The inferior trunk will give off the anterior division, which leads to the medial cord. From there, the medial cord will have one main nerve that runs medially towards the humerus or down the humerus, that will run and stay on the pinky side. So we have the purple pinky, which is the ulnar nerve. Coming back to the medial cord, you also have a contribution of the median nerve. Also coming from the lateral cord, you have the same median nerve, which join and run centrally down the middle of the hand through the carpal tunnel. Laterally, you also have one last nerve. This is the musculocutaneous. This is going to ultimately innervate a majority of the elbow flexors, with the exception of the brachioradialis, which is the radial nerve. The musculocutaneous will terminate its muscular portion and run into the forearm to give cutaneous innervation. You can end it.